Good afternoon, everybody. Thank you so much for coming. We have some really good news for people and a lot of information. So I want to get started. I have also with me today, I have Joyce and Lisa from AJ Gallagher. They're our consulting folks, and they've helped us with a lot of important things this year. And amongst them is joining what's called a risk pool. We know it as the IPBC, and Joyce will explain why that's helpful and beneficial to you and to the city as well. I'm going to start out, though, talking about some things that you would probably want to know about here at the city, just general health benefit related. Then we'll get into our insurance plans. And I wanted to say at the start of this, since there's a mixture of people here, I'm going to be talking, and obviously talking to everybody. Everybody's going to may be affected somewhat differently by it. We have classified employees, classified library, township, Lodge 1000 that are definitely making changes to the new plans at this point and the higher level benefits for dental and life insurance. And that's an exciting thing for us. Then we have other people that we're in conversation with, other bargaining units, and then also, so we don't know, it'll depend on where things end up here by the time we make these changes in January, seeing how it'll exactly affect you if you're in one of the bargaining units. If your bargaining unit makes changes, obviously you'll make the changes as well. So um, bear with me with that. I'll be here for questions at the end of the meeting. We can certainly take questions as we move along here. I want you to know this session is being recorded. Uh, Scott and Craig are going to be putting it out on the city's YouTube site, so you can hear it again. You can listen to it at home, or people can hear it if they haven't been able to attend. But I just want to make you aware of that so that while you're asking questions, you know that you're being recorded. So if you want to wait till after we're done and ask questions on a personal basis, come up and talk to any one of us, that's just fine as well. So let me get started, and we'll move ahead here. Hello. Um, Quite a few things to talk about. The two different plan arrangements we're calling the new plans the enhanced plans, and you'll see why that is. I have premium information to talk about and give out at the end of the meeting. We're going to talk about people needing new benefit cards, and again about the IPBC, the risk pool that Joyce is going to talk about at some length. So one thing I think most of you are aware that we're doing an eligibility verification on all dependents. This affects you only if you have a dependent on one of the city's plans. If you have no dependents, single coverage, this does not affect you whatsoever. So we've asked people to get with this company, Consova. They've been sending letters to people to respond to them and make sure that you verify that your dependent is eligible for coverage. If had a very good response rate doing that, about greater than 75% at this point. But that still means that there are about 25% of our population with dependents that haven't responded or haven't completed their response. And as of yesterday, the company was sending another set of letters out to those folks urging you to please respond, because eventually if you don't respond, we're going to end up dropping your dependents off the plan. So that's probably not an outcome that you would want. So I have information. I can send you this information. It should be in the letters you're receiving. Or if you want to call me or email me, I can get this to you in case you didn't get a letter. Um, but please respond or get with me, and I can help you to get that information. Okay. Well, Tina Swanson, our wellness coordinator, has already set up our flu shots for the year. I think an email went out about that yesterday. And for those of you who don't have access to city email, the information's here, and it's on the back table over there. You can pick it up. There's a whole state, 5 different time periods when you can get your flu shot. It's free to you, free to your spouse if they're on the plan. And you don't have to make an appointment to get your flu shot. It's just a walk-in clinic. This is new for me to talk about here at our meetings. This has to do with patient safety and at hospitals. I've been wanting to get this information out to people maybe through on a website somewhere, but that hasn't become available to us yet. So I'm just going to talk about it here. And since it'll be recorded, or I can send you information if you contact me, this is about reporting systems who monitor hospitals. The hospitals report to these various organizations, and then they look at the data and they take a real deep dive into the data, and they give these hospitals um, ratings based on the data that they collect. Now, these different organizations collect different data. Some hospitals respond to some and not to others, so not every organization is going to have information on every hospital. But this is important because you can find out what hospitals have a really good track record of patient safety. Sometimes it's by procedure, knee, hip surgery, coronary procedures, or whatever. And sometimes it's a general overall thing about infection rates, or people have to coming back to the hospital. So it's something that you may want to use for your own personal information if you are going to the hospital, or you have a loved one going to the hospital. You may, and in advance, you can check out the various uh, reporting so that you can find one that you feel is the safest. And sometimes they're going to contradict each other, but you can read quite a bit about how they look at the data. And actually, some hospitals cater more to sicker people, older people, and they take those things into account when they rate the hospitals. They do something with the statistics to make it apples to apples. So you can be sure that they're all doing that. So I've just listed 3 organizations that I'm aware of. I know that Blue Cross does this, and I'll show you a little bit on their website. Um, then an organization called Leapfrog. They do what's called the Leapfrog Initiative. They're a not-for-profit company organization, so they're not biased. I feel like, and they've been around a long time. I feel that they're like unbiased because of their not-for-profit status, and they do really good work. And then Medicare, the people who run Medicare for us, hospitals are required if they serve Medicare populations to report there. So it's another what some of the reporting looks like on the Blue Cross website. If you search for hospital provider, you can find this in there. I was trying to reconstruct myself yesterday how I got to this information, and I wasn't 100% successful. But when you look at the website, you'll see that those are stars. They didn't come up in the computer as stars. So you can see some hospitals have 5 stars, some have 2 stars. Information for you. And this is the Leapfrog, one of the Leapfrog pages, and there's a lot of information about patient safety on the Leapfrog website. This happened. I put this particular page on here because it shows that one of our local hospitals, OSF, St. Joseph, has had several years in a row getting top rating for patient safety as it's constructed by the Leapfrog people. Different topic now. This pertains to people who are classified employees and are eligible for sick leave buyback upon retirement. That's not all our classified employees, but quite a few. So there is a new law that was passed this summer in Illinois legislature and signed immediately by the governor and went into effect, I think, that very day. And it's called the Local Government Wage Increase Transparency Act. And it affects only non-union employees. And what it does is it requires uh, that the payout of sick leave be done only after it's been discussed. And I don't think it needs to be voted on, but it does need to be talked about in an open meeting in your community. So essentially this would have to, your payout goes in front of city council, and it has to list um, must be disclosed in a public meeting and posted or put on the city's website, must identify the employee, purpose, and amount of payment, and proposed retirement date, the effect of the payment on the pension. So if you're a person who this pertains to and you're thinking about retirement, you may want to come and talk to me about it, and we don't have a process yet in place for this, although we're working on it right now. Haven't had anybody yet fall under this, but it's going to happen soon. So one way or the other. So just want to make sure everybody's aware of it, not to be shocked if you're putting in for your retirement, that this is something that will involve you in a public forum. Okay. Right. we have a retiree here today or so? Thought I might have seen somebody. No. Okay. Have information for retirees, and they were invited about their changes, but I'll skip over that for now, so we don't have that. And I will introduce Joyce here, talk about the specifics of the plans, and feel free to ask as she goes along. Good afternoon. Let me switch this over. Out how to use the mouse to advance the slides, so I feel like I made progress. Okay, so as Laurie mentioned, you're going to be joining a talk about in a little bit is some benefit changes for some of you. You can vendor Blue Cross remains your PPO provider for medical by the state's preeminent public sector vendor. So Ansel Glink is the attorney that drafted the initial bylaws for this cooperative. Sikich does our audits. Miller Cooper does our accounting. So these are all entities that only deal with public sector employers, and we think that's pretty important to have expertise in that area. And then Gallagher is the consultant for the cooperative, and our team specifically only works with public sector employers. That's all that we do. And it's access to what all of those things are. Hold it up farther. Okay. Is that better? And as a result, our renewals for the cooperative have been very stable and budgetable and predictable. We have had single-digit renewals. I've been with Gallagher for 6 years. I think the last double-digit renewal was 2009, perhaps. It's been quite a while. So that, again, that's information that is available to you. Okay, so now apparently I'm going the wrong way. Okay, okay, so this is an example of some of the communities that are members. As of July 1, we have 102 that are participating in the cooperative. The communities listed here are what we call voting members, of which will be one. So what that means is when an issue comes up to vote, and an example I can give to you is earlier this year we talked about managing hepatitis C drugs. There is a program through the Express Scripts program that helps patients with hepatitis C drugs. So that is something that was voted on overall. In 2011, we voted on health and safety edits for drugs so that they were checking for drug interactions as an example. That was something that was voted on. The renewal gets voted on. Vendors get voted on. So everybody that's a voting member gets a full vote at the table. The communities are informed of what the issues are. Meeting packets go out, kind of like what happens with your city council, so that people are informed on what they're going to be voting on. Then we have a number of small communities that band together because they are not large enough to be a voting member, but they still would like the purchasing power that they get, so they band together in what we call subpools. Mouse. So these are some of the smaller communities that have joined the cooperative. We've got a group of communities in southern Illinois. Effingham and Rantoul recently joined. On January 1, we're putting together a bunch of communities out in the Quad Cities as well. So it's not just Chicago metro communities that are included. There's actually people all over the state.
And we continue to talk to more and more communities throughout the state in terms of the benefits of this program. So what you mostly want to know is what's going to happen to you. How will this affect you? One thing is that the Blue Cross and Blue Shield plans will have a new policy number. So whether you're keeping the benefits you have now, you're picking the Blue Cross HMO, or you're transitioning to this enhanced plan that we're going to talk about in a little bit, you will get a new ID card for that. So that's just something that will happen as a matter of course. How many people are signed up for Blue Access for members right now? A couple of you. Okay, if you have Blue points that you've accumulated through that wellness program, you do need to spend those prior to the end of the year. They will not transfer those over, just so you know. So make sure that if you have those accumulated points that you use those up. Yes, and then you can, once you have your new policy number, obviously you can re-up for that next year. So a change for you will be that the Blue Cross HMO Illinois network will replace Health Alliance, so that is different. How many people here have Health Alliance now? So a number of you do. Okay. So really the two big doctor groups in town have the Blue Cross HMO. We can show you how to look up the providers. I think some of you have gone onto Blue Cross's website already to do that, but that will be something you'll need to think about and look at the network carefully. Express Scripts will be the new prescription vendor. So again, you're going to get a separate prescription drug card. We'll have more information for you when we actually do open enrollment. Just so you know, formulary drugs vary from company to company, so they may be different, but we'll have the ability to have you look at all of that stuff before you get started with the program. And your doctor may need to write a new prescription for you for a mail order drug. My doctor sends them right from his computer in the office for me directly to Express Scripts, so your doctor may be able to do the same thing. I always advise people if it's getting close to the end of the year and you need to get something refilled, get it refilled before the end of the year, and that way it gives you a little more time to get all of that stuff around the holidays, as sometimes it's hard. But all of this is taking place on January 1st, so that's when the change will be made. The standard is the new life insurance carrier, and it includes an employee assistance program. Not listed here is also travel assistance, so they have that available as well. Your dental will remain with Blue Cross. Your flexible spending administration will remain with 121 benefits, and vision will remain with VSP. So that's no change at all for you. So why would the city do this? We talked long and hard about making this decision with the city, attended council meetings. The real reason is group purchasing power. Right now there's about 14,000 employees, and when we add in dependents, it's over 30,000 people that are a part of this group. So what that means is you're getting, for example, better life insurance rates, better administration fees, et cetera, that are included in the program. You still have flexibility in plan design. There's been stable renewal increases, again, because it's spread across so many entities. The renewals are more predictable. If anybody is covered by Health Alliance, you've seen that there have been some high increases on that HMO plan, particularly last year, I think was a higher increase year. And the other thing that we can do is comparison to other communities. So what are they paying for copays? What are the employees paying for contributions? What are the average deductibles, et cetera? That's all information that we share with the city so that they can make informed decisions on plans. The other big thing is that there's a built-in wellness program component. So we have not chosen a vendor. We're talking about that now. But as part of the premium that you pay, wellness funding is built into the program, and it's not only the cost of a wellness screening, but the ability to earn incentives. So at the end of every fiscal year, which for us is July 1, we look at what the wellness efforts have been by community. You can earn a wellness incentive of $50 per participant, $100, $200, or even $400. And we talked earlier today about what will happen with those incentives, and we're talking about obviously a strategy to return those incentives to the employees. Some communities have used those incentives to do things like buy exercise equipment at City Hall. Usually police and fire have exercise equipment. City Hall employees may not have access to it, so that's just one example. Some have purchased Fitbits. There's other things that can be done. But that's a really nice incentive to participate in wellness. So now we're going to talk about the proposed plan changes. As you can see, the current plan is a $400 deductible or $300 if you do the health risk assessment. So that health risk assessment piece has been really difficult for the Blue Cross to track for you. Some people have questioned, am I really getting that $100 credit? Am I not getting it? So one of the things that we're talking about is replacing that with a wellness incentive being returned to you. Um, so the new plan will be, again, a $400 deductible per individual. It will still be 2 deductibles per family like it is now. The difference will be in the proposed and new plan, a higher out-of-pocket amount that will apply to the medical plan. So deductible will be the same. When we looked at your claims information, a lot of people weren't even hitting the current out-of-pocket amount. This is really going to affect people who use the plan more, obviously. Um, so that was a decision that was made. The other thing that will change is that the emergency room copay will go from $100 to $250. I don't know how many of you have visited an emergency room. I have. I can tell you that the cost of care in an emergency room versus going to urgent care is much higher. So obviously this is a way to be a consumer, just like Laurie gave you the information about checking out hospital ratings. It's the same type of premise. So that will be a change. On the prescription drug card side, the generic drug copay is going down from $15 to $5. So if you're taking generic drugs, if you're able to use those, obviously that's money savings out of your pocket as well as savings for the city. On the other side, the brand name formulary drugs will be the same. The non-formulary drugs are $45 currently, and that will go up to $50. So again, it's just paying attention to what your options are and things that you can take. So for the HMO, similar to the PPO plan, that emergency room copay is going to increase to $250, but the outpatient surgery facility fee of $150 per procedure is going away. That will no longer apply. And again, as I mentioned, the network will change. So we're happy afterwards to share the network information with you. It's pretty easy. If you go to the Blue Cross website and you look at the provider finder, you just pick HMO Illinois, put in your zip code, and that will give you the primary care physicians in the area. I did a 15-mile radius check. I think there were 105 that came up. So it just depends on where you live and if that's convenient for you. And just so you know, the specialists aren't listed on the website. So you have to ask your doctor, if you're considering one of the doctors, call them and say, I'm being treated by a chiropractor or an allergist or whatever it might be, and ask who they refer to. And if you have somebody specific that you use, ask them if they refer to that doctor. That's the best way to know that you would still be able to see the same specialist. Somebody earlier asked if a new referral would have to be obtained, and the answer would be yes, you would have to get a new referral. So the next steps, as I mentioned, you can look at the Blue Cross website. It's listed here to look at a new primary care physician. Advocate and St. Joe are both included in the network. So I can't guarantee you that every doctor you're seeing today, if you're in the HMO, is included, but there's a pretty good chance that they will be. And remember, women can choose too. So we can choose an internist as well as an OB-GYN doctor as long as they're affiliated in practice. Now let's talk about some of the better stuff. So we are going to make some changes in the dental and life plan. So the dental plan currently has a $25 deductible, 3 per family, and that will be going up to $50 and $150 per family. But the big news is that the annual maximum for dental is $1,000. That will be going up to $2,000. And if anybody has had a crown, you know that you're exceeding that $1,000 easily in a year. So this should be a good benefit to help people out that have dental expenses. Most of us do. And then the other good news is the orthodontia lifetime maximum would be increasing from $1,500 to $2,500. And if you've had a kid in braces, again, my last son's braces were $4,500. So that's a huge improvement in benefit. And just remember, anything that's not covered under the maximum, you can put aside flexible spending dollars to pay for that. So that's a good avenue to pay for that on a pre-tax basis as well. So for those of you that only have a $25,000 life benefit currently, the city will be increasing that to $50,000. So that's a benefit enhancement as well. That is the end of the formal presentation. As I mentioned, we're able to answer questions for you about the network. If you have individual questions, we're happy to answer those. I'm going to have Laurie come back up, kind of be our moderator, because I'm sure that you have some questions about all of this. Thank you for coming this afternoon.
Thank you, Joyce. Hopefully this is still recording. It's showing red instead of green. Questions? I have premiums up here, and they're by group, employee group bargaining unit. I have the premiums for classified, library classified, township, and Lodge 1000, which are the groups that will be moving to the new plan designs with the better life insurance, better dental benefits, and the new health insurance level for out-of-pocket and the pharmacy, the generic copays and so on. I have that, and then I have for the 362 bargaining units, based on the assumption that there are no changes currently. I have ones that would show if you do make the change, but I didn't bring that with me. So the 362 people have a slightly different share of premiums by single family employee plus one. So I have a sheet for you, and then I have a third sheet for people who are in 699, fire, police, and so on. With well, police will be changing actually. So fire and 699 and 699 library. Hopefully I'm not forgetting anybody. Oh, telecommunicators are with, if there are any telecommunicators here, they're under the classified, they may be under the classified employee benefits. But if you have questions, ask me. You can have whatever premiums you want, but if you want a specific one, ask me. Yes. So I'm going to repeat the question so hopefully they can get recorded. So the question is, do I have to find out if my doctor or provider is in the network? And the answer is two-part. If you're in the PPO plan, the network is the same as it is today, absolutely the same. If you're in Health Alliance, the answer is yes, because they're a different set of network. There are a lot of doctors in the Blue Cross HMO network. I'm sure it's bigger than the Health Alliance network overall, but it wouldn't necessarily be a one-to-one matchup of who's in it. Okay. Other questions? Well, if you think of any and you want to come up and ask personally, that's just fine. I'll be around. Of course, I'm around. You can email me, call me. Cindy Eagle's available. She's getting on board with understanding a lot of this and should be able to answer most questions, and of course, people in HR. So thank you so much for coming. Yes, Robbie? Yeah. Oh, when is open enrollment? I'm planning for the beginning of November. I hope to have that in place. And so, of course, I'll let out information about when that is. And we'll be sending emails and letters home with the details of the plans and the premiums and so forth as we get closer to that. Right, right. And we're going to have additional meetings. I was just talking with Joyce and Lisa about that over lunch. We're going to bring having meetings closer to open enrollment or maybe even one-on-one meetings. We haven't decided exactly. So particularly I said we need to make sure we have early morning or later afternoon meetings so we can hit people on different shifts or different schedules. And I was thinking specifically of folks in your area. And last year I know that we sent complete packets to everybody in 699 through the mail so that they could have them at home. And maybe, I don't recall, I may have sent it to everybody, but I know specifically we want to do that for your folks, and people usually in water don't have email as well, and some other places. I'm very aware of that issue, and we talk as often as we can about maybe getting wider access to information at City Hall. So something we would continue to look at. Okay. All right. Well, thank you very much.